Dr. Aminu Magashi Garba. I'm the coordinator of the Africa Health Budget Network based in Abuja, Nigeria.
What are some of the present needs in health infrastructure in Nigeria and Africa?
We need to look at infrastructure at a different level in Nigeria and Africa. We have the primary health care, we have the secondary, we have the tertiary. And every layer of this health sector, it has its own pressing need for infrastructure. So for example, the primary health care, that is the lowest where people live and work. The infrastructure needs in that kind of environment is the basic minimum infrastructure that will allow patients and health workers to attend to a simple infection like malaria and typhoid, and also address issue of delivery for pregnant women. So for example, there should be electricity as part of infrastructure. There should be water system, like either a borehole or a pipeline water. The place needs to be secured. It should be fenced, and also we need to have all the personal protective equipment that will allow a health worker to attend to a client without any risk of infection. That is the primary health care. When you move to the secondary level, that is a little bit above the primary. So in that situation, patients are being referred from the primary to the secondary. So they need machines, big machines, that could do diagnosis, that would do treatment, that could also attend to emergencies. So for example, we need like an ultrasound machine that can scan a patient, for diagnosis and also treatment. We need ambulance services that could attend to emergency by the roadside and refer to a patient. We also need a lot of, drugs that could also be provided for the client. When we move to the tertiary level, that is the teaching hospitals that we are talking about in Nigeria and Africa. At that particular level, infrastructure means that Africa and Nigeria, we are capable of producing our own drugs within the country, within the continent. It means we need infrastructure that can manufacture our drugs. Don't forget also the local vaccine production. So infrastructure will also allow Africa and Nigeria to also produce our vaccine. Right now in Africa, over 60% of all vaccines we are using are imported and are also either donated or supported with a discount rate. So we need all these services in Africa and Nigeria to be able to produce our vaccine, to produce our drugs, and also a manufacturing industry that every personal protective equipment, like a face mask, a face shield, surgical gowns, the boot, we can all manufacture them. All this is about infrastructure in Nigeria and in Africa.
Are those biggest challenges updating or maintaining existing infrastructures or building new ones?
So the challenges are both sides. We need to upgrade, we also need to maintain. So that the maintenance culture is one of the biggest challenges in Nigeria. You could see a governor, you could see a minister providing billions of naira, millions of dollars to equip a hospital. Come back after 1 year or 2 years, the structure have collapsed, or they are obsolete, or they are not working at all. Because when you equip a facility with all the sophisticated gadgets, you need a stable electricity to maintain that equipment. You need security, you need maintenance, you need reagent, you need a lot of things to maintain. Unfortunately, we provide all these billions of naira to procure machine and equipment, but the maintenance culture is zero. Or at times, even the health workers, they want to do it, but there is no recurrent expenditure, a budget in the facility to maintain that. So this is one area of the challenge. The upgrading is also very key. So for example, any equipment we buy, some equipment that could do prevention or diagnosis could cost us like $1 million US. But after a while, that machine will require an upgrade. The technology of that machine is obsolete. You don't have to remove the equipment, but you need to upgrade the equipment. Sometimes the money is not available. The person that procured the machine has already gone. The new governor would say, that's not my business, I didn't put it there. So these are the challenges are both upgrade and also maintenance culture.
What can be done to improve the health infrastructures in Africa or in Nigeria rather? And what is the role of government?
So the government should not only provide the funding. the government should also provide the enabling environment for a private sector to also thrive. And when I say private sector, I did not mean only the private sector that is making profit. The civil society organizations in the world, the non-governmental, they are also private sector, but not for profit. We should allow them to also thrive and partner with the government into a public-private partnership. So government can provide the funding, government can provide the enabling environment, and also government can provide the regulation and the oversight function, and allowing also the private sector to play a role. In Nigeria, currently, there's a lot of legislation right now in Nigeria. We have what we call the Nigeria Infrastructure Health Development Bank Bill. Now, this is a bill already before the National Assembly. A lot of effort has been done for National Assembly to pass the bill so that the health sector, for the first time in the history of Nigeria, there should be a bank for health that will also provide funding for infrastructure development. This is the role of the government. So we hope that someday we get it there, whereby there's a bank. We have a bank of industry, we have the bank of agri, then we have a bank for health that can deliver for the health sector.
To what extent do health workers bear some responsibility?
So one of the biggest challenges, within the health facility is the maintenance culture. And when we talk about the maintenance culture, it is the health workers. It is the human resources within the facility that need to maintain equipment. If I come to the facility and it's not hygienic, or there's a poor sewage system, or there's challenges within the maternity, or there's a lot of smell, then definitely, before we look at the government, we have to look at the health workers. And the health workers is not only the workers. The professional bodies of that health workers have a role to play in providing advocacy, sensitization, engaging the government meaningfully to ensure that we maintain all our infrastructure and also we upgrade them to the level that they will provide quality health service for Nigerians.
Can you talk about some pros and cons when it comes to foreign funding infrastructure development?
So it can go either way. Let's take, for example, most of the government, big infrastructure development, be it in health or education or anywhere, at times they are foreign funded, either by international development partners, by international financing institutions. So the government sometimes secure a loan or a grant or a credit to provide funding for development. Now, in that kind of situation, what we needed is transparency and accountability. Every money that the government uses from the foreign partners to procure infrastructure, we need government to be transparent, to be accountable, and to be efficient. This is the pros. So it's good to do that. On the other side of the cons is that if we are only relying on the foreign funding, so sometimes if there's no foreign funding, the health sector will collapse completely because the government is not putting its own money to provide services. So the pros is positive, but the cons also is negative for total reliance of international donor funding.